It's an honor to be standing here in front of such an esteemed audience. I can't help but notice on this slide right here, when I first saw it, when it says hashtag teeth in Medicare, my first thought was number of teeth in Medicare. What does that mean? I don't know. But it just shows I'm getting old. And as an aging dental patient myself, my dentist actually told me that if I maintain regular preventive visits with her, she guarantees that I will keep my teeth for my entire life. Guarantees it. And she said she'll even give me the little box to keep them in. I jest, she never really said that. Now, moving right along, they gave each one of us 15 minutes or so to speak, and which is good because 15 minutes is about the extent of my knowledge base. So any more than that, and I run out of things to say. So I want to talk about some things that we have done as an insurer, some studies we've done, but it will be a very, very high overview, just because of the time. And if you need more information, I'll give some sites that you can go to. This is yes, that's actually the response I was hoping with this slide. Yeah, you read that quickly too. It is quite amazing that research has recently shown that the mouth is connected to the rest of the body. Who knew? Who knew? And of course, that slide is in jest in a way, but it is. I mean, think about it, and we're talking about that. I don't have to tell this group that, but to think that the mouth is separate from the rest of the body just does not make intuitive sense, right? Let's go over some statistics. Now, we heard a little earlier about statistical or data wonk, is that what that was? Yeah, data wonk and emotions, going over emotions. I'm kind of an emotional wonk, so that was supposed to be funny. But these data come from the CDC and a few other sources, but primarily the CDC. And there may be some inconsistencies that were shared just a little bit earlier. That doesn't mean that the numbers are wrong. It's just that these are more aggregate numbers, and so sometimes that makes a difference. And plus, we all know that 87.2% of all statistics are made up on the spot. So when we look at 47.2, does anyone know what that number means? 47.2. That's a CDC number that's been floating around for a while. That's the percentage of adults in the United States that have periodontitis. About half the adults in the United States have periodontitis. 70.1, that's an aggregate number. That's the percentage of adults 65 and older that have periodontitis. Think about that. That's a staggering number. 70.1% over the age of 65 and older. Does anyone know what the less than 5 is? Less than 5% of people with periodontitis actually get it treated. Think about that. Hang on, I got to do a little math. That means that more than 95%, notice how I did that, more than 95% of people with periodontitis do not get it treated. That's amazing. Think about that. That's amazing. Now, 40 to 50, that is the approximate percentage of people that have at least one chronic medical condition. That may vary, and again, that's over the whole population. 86.8, the approximate percentage of people with type 2 diabetes that also have periodontitis. When we talk about comorbidities, the comorbidities of periodontitis with some of these chronic medical conditions is amazing. It's staggering. 91, the percent of people with some form of cardiovascular disease who also have periodontitis. Now, I want to make it really clear, we don't know if periodontitis causes any of these things. I have heard dentists tell patients, you know, if you don't get your teeth cleaned every 6 months, you will die of a heart attack. I have had patients report that to me. Well, that's what the patient reports to me. Did the dentist really say it? I don't know. But we don't know if one causes the other. We just know that they exist together, sometimes same risk factors. Sometimes there might be a symbiotic relationship of sorts, like between diabetes and periodontitis. But that's a huge number, huge number. 75, the percent of healthcare dollar spent on treating chronic medical conditions. Huge, huge. Anyone know what 10 is? 10 is the number of chickens I have in my backyard. I'm surprised you didn't know that. Okay, so United Concordia did a study in 2014. It's published in 2014. I'll give a quick overview. It received some attention, even by this group. It received some attention. Effectively, what it did, it took 1.7 million claims records of people who had both dental and medical insurance and looked at them over the course of 5 years and identified the people that had both a chronic medical condition and periodontitis. Now, there were certain assumptions that had to be made because in dentistry, of course, we don't have diagnosis codes. How do we know? Well, it was a claims history sometime in the past of a person having a periodontal procedure that would be related to periodontitis. And so there are some assumptions there. Of the 1.7 million people, a little over 300,000 had both a chronic medical condition and periodontitis. And those people were split into two groups. One group had underwent a periodontal treatment program, and the other did not. And as we know with the numbers, less than 5% actually went through the periodontal treatment program. Now, this is all retrospective, looking retrospective, so we don't know what other factors were. However, the medical costs for each group of people was about the same before the periodontal treatment. It was about, when you look at plot graphs, they're about the same. And we found this. On the left is the approximate average savings of medical costs annually for the people that had periodontal treatment. And we're looking at diabetes, stroke, heart disease, and I can't see the other one. Oh, pregnancy, the chronic disease of pregnancy, yes. And on the right are the reduction in hospitalizations. Now, medical spend is important, and when we look retrospectively, we can't think prospectively and say, if somebody gets their gums treated, does that mean they're going to save money medically? We don't know. We don't know. I think we will know in time, but we don't know. But what we can look at is the reduction in hospitalizations. When somebody is not in the hospital, where are they? They're working. They feel good. They're going on vacation. They're spending time with their children or their grandchildren. It's a change of life type situation. So it is critically important, and the reductions are significant when we look at that. Now, if you're interested in that study, here's the URL. Copy it down. I put that up here to be a joke. This really, if you did do this and did it exactly right, it will take you to the study. However, there's easier ways of doing it. Just Google it, right? Google it. You could go to the United Concordia website, ucci.com or unitedconcordia.com, all one word, and do a search for a chronic disease study. You'll find it. So it's easy to find. There's a new study that we did called Value of Going. And what we did there is we wanted to see what happens when patients just go to the dentist regularly. We didn't look at chronic medical conditions. We didn't really factor anything else in. It's just what happens to medical dollars for those people that go to the dentist regularly. Now, the study is broken up in certain ways, and the data are sliced certain ways. The bottom line is this. You can look at this as two groups of people. There's the group of people for 3 years went to the dentist every 6 months, twice a year, every year for 3 years. Okay? They went to the dentist twice a year, every year for 3 years. Compare them to the people who didn't. And the people who didn't are sliced up in different ways, but you just think about it, those two groups. The people that went to the dentist twice a year, every year for 3 years, had lower medical costs than the groups of people that didn't. And actually, from a differential between the two groups, it was actually kind of significant. The actual dollars, medical dollars saved on average is not really that significant. You can look at these numbers. Over all age groups, $68 per person per year was saved medically. Not something to write home about. But the difference between that and the people that didn't go was pretty significant. We also didn't evaluate other factors that might enter in. The person who goes to the dentist twice a year, every year for 3 years, that's a weird individual, right? I'm one of those weird individuals. I'm sure most people in this room are some of those weird individuals. We also do other things that are weird, like take our medications and go to our physician and maybe exercise and eat healthy or semi-healthy. We follow the rules, right? So we don't know what those other people were doing, but we do know that going to the dentist, and we all believe this, going to the dentist is an important thing. It's part of good behavior. So that's important. And here's the site for that. Again, you can do the same thing I said before. The other study, Google value of going, go to United Concordia's website and look at value of going. That'll get you there. So we know that there's three primary things for improving someone's health. Creating access to get treatment, right? That's important. Communicating to people. We got to let people know that it's important. And then, of course, there has to be some level of behavior change on the person who needs the treatment. I like you to look at it this way. You can go up to somebody who's starving or malnourished, and you can say, here's a sandwich. Make them a sandwich. Give it to them. And that's sort of like access, right? You're giving them the sandwich, giving them the food. And then you tell them how important that sandwich is to eat. You give them all the information they need to know. They still have to reach out and pick up that sandwich and eat it, right? And that's the behavior change. We can't drag people to this, so they have to make the decision to commit and to follow good behavior. Now, hold on, don't run it yet. I have to say, this is a TV commercial. I saw this a couple of months ago, and it really piqued my interest, not only because that's a good-looking sandwich. I'm hungry right now, and I look at that and I think, wow, that's a nice sandwich. I want a few disclaimers here. This is a Jack in the Box commercial, and Jack in the Box says something that bothers me here in this commercial. Should bother all of you as well. Now, with that said, I have nothing against Jack in the Box. In fact, I would encourage you to go get that sandwich if you like it. It's good. Go get that. I don't own any stock in Jack in the Box. I don't own any franchises. I don't own any franchises or stock in any companies that compete against Jack in the Box, so I'm completely neutral here. I just want to show you the commercial. And Jack should be very happy with that because I'm giving him free advertising, right? Go ahead, if we can get this thing to play. We'll see. Here we go. Or maybe not. Okay, well, you know what? We can just go back. I'll describe it. If you see this commercial, then you'll know what I'm talking about. Essentially, it's Jack walking out there talking about his new sandwich, right? And he says, this is the perfect remedy for the unpleasant things in life, and then there's flashes on the screen of various things that are unpleasant. One of those things, quick flash, it's almost subliminal, it's so fast, is the dentist. And he says the dentist, okay? Close talkers flying because there's somebody sleeping and drooling on the next guy, the dentist, and then a couple other things. It's what we have to deal with. It's one of those things we have to combat. In society is this negative perception of dentistry. It's almost like the joke of healthcare, going to the dentist, no one likes that. Which then leads to behavior. right? Because that kind of thing affects people's behavior. And we're working on some things at United Concordia to actually address behavioral issues. I am a licensed psychodontist. No, I'm not. I just made that up. And I have a colleague there, Erica Coffin, you can wave, and she's actually working with me very closely on a lot of these things. She actually is the behavioral guru on this type of thing. But these types of things like the Jack in the Box commercial, they affect how we feel. They affect how we think, which then affects how we act, right? And when we look at somebody and the behavior, there's like two major components of that. A person's readiness to change and the person's confidence to change. There are people that are just simply don't care and they're not ready to change. We have to work toward moving them in that direction. Everybody's different, everyone has different reasons. And there's different levels of readiness. Some people are thinking about it, some people are planning for it, some people are actually doing it. And confidence. Confidence is a big deal. There are some people that know they need to change, but they just think they can't for whatever reason. Maybe it's a money issue. We heard about the disparity of money. Maybe it's a money issue. They can't afford it. They have no confidence that they can actually pay for it, so they don't do it. So we need to work on all those things. And I would encourage, as we move in the direction of looking at dental care being part of more overall health care considerations, that we also think about the prospect that providing a benefit, just a benefit, is not enough. We also have to know where the person's coming from and provide the avenue for that person to become knowledgeable and then to make those changes and act upon those changes. Thank you.